Now, patients typically fall into one or more categories. Their complaints are a result of either breakdowns in the structure, neurological, or the metabolic systems of their body. Some people have challenges in one system, some two, some of all three. Now, one thing we have not yet talked about are the metabolic problems that I see many times in fibromyalgia patients. Now, these metabolic imbalances significantly contribute to your symptoms. Now, what we do is we use specific metabolic treatments based on specific lab tests. We do a thyroid test, a complete metabolic, blood work. We check your lipids and a complete blood chemistry with something called autodifferential. We assess your thyroid, your adrenal glands, your liver, your kidneys, your white blood cells, your gut function with all these lab tests I just mentioned. Now, all of these tests can be affected in chronic health conditions. By addressing any problems with your thyroid, adrenal glands, your blood chemistry, your gut, we can help you heal faster. Now, the complete metabolic blood work also allows us to check your blood glucose levels, since glucose and oxygen are needed by the brain to function properly. We order sensitivity testing to see if you have any sensitivity to milk, gluten, soy, yeast. If you are sensitive to any one of these food groups, this can make your condition worse and will increase inflammation of your brain and your body. If you have symptoms such as chronic pain or fatigue, indigestion, bloated after eating, problems going to the bathroom, constipation, ulcers, or you vomit after you eat, this could indicate you have a sensitivity to one or more of these foods. And the only way to know is to do the sensitivity test. Another test that we frequently order is an adrenal stress index. This is a saliva test that we use from the mouth. It's kind of like DNA testing. Now, your adrenal glands are your stress organs throughout the body, meaning they react to stress. If you've been under a lot of stress, this test is a must. If you suffer from insomnia or exhaustion, this test will measure cortisol levels throughout the whole day, so we see where your peaks and valleys are according to this test. Now, when these levels are abnormal, you will suffer from insomnia and you'll always feel tired. Now, these cortisol levels can be corrected using a very specific nutritional protocol, and we can help eliminate your insomnia. We also check for autoimmune disorders. Now, an autoimmune disease is where your kind of immune system attacks a particular area of your body, your nervous system, the joints, connective tissue, or even your thyroid. So we test specific antibodies to determine if you suffer from an autoimmune condition. For example, many chronic pain or fatigue patients I've treated have tested positive for thyroid antibodies, and they're actually misdiagnosed. Now, your thyroid tissue antibodies, they're called TPO, thyroid peroxidase, and TPG, thyroxine-binding globulin. If they are high, you are suffering from a condition known as Hashimoto's disease. Now, the only way to find out is to test these thyroid tissue antibodies using the blood work. If you suffer from these tissue antibodies, then we order further blood work to determine which part of your immune system is not functioning properly. We run a test for something called H. pylori bacteria. This is a type of bacteria that can inhabit your gut and areas of the stomach and intestine, and determine if you have any problems related to gut function because of these bacteria. We may order intestinal permeability tests to see if you suffer with something called leaky gut syndrome, or LGS. Leaky gut syndrome is a condition of altered or damaged bowel lining caused by antibiotics, toxins, poor diet, parasites, or infection. It can lead to increased permeability of the gut wall to toxins, microbes, undigested food, waste, or larger than normal molecules. And it's been hypothesized that when you absorb too many of these substances into your body, you could have an immune reaction by these substances. We test for something called neurotransmitters. Now, these neurotransmitters are essential for proper brain function. They include dopamine, serotonin, acetylcholine, and GABA. Now, deficiencies of these neurotransmitters can show up with various symptoms related to depression, anxiety, problems with social interaction, solving problems, memory recall. Since we see many of these symptoms associated with fibromyalgia, it is essential that we assess the function of these neurotransmitters. We can check your hormone levels, determine if the patient suffers from a low testosterone in males or low estrogen progesterone levels in females. Now, symptoms related to decreased hormone levels may include depression, fatigue, mental fogginess, mood swings, hot flashes, night sweats, weight gain. Again, you can see that many of these symptoms are characteristics of many fibromyalgia patients. Lastly, we test for inflammation in your system by testing your homocysteine and C-reactive protein levels. Many patients suffering with chronic health conditions suffer from inflammatory processes. Just about every single fibromyalgia patient I have seen suffers with some sort of inflammatory process. So as you can see, there could be many contributing factors causing your symptoms. We look and test for all the areas, so we are not just shooting blanks in the dark and just guessing. By doing many of these metabolic tests and correcting them we can help fibromyalgia patients. Whew, a lot of information I'm throwing at you. But wait, we talked earlier about, this overfiring mesencephalon or your cerebellum not working correctly. What do we do about them? Because without correcting the mesencephalon and cerebellum, you're not going to get better. So we do specific neurological treatments based on specific neurological tests. Now, one of these tests is called Romberg's test. This test will kind of tell us the overall health of your cerebellum. What I'd like you to do is first listen to my instructions, then pause the video. Okay. First, what I need you to do is stand up, put your feet together, and then you close your eyes. Now, if you think you're going to fall, open your eyes or catch yourself or have someone close by. So you stand there with your feet together, eyes closed. All right? Did you feel yourself swaying or moving from side to side? If you were swaying or you feel like going to fall, this can be a problem with your cerebellum. Now remember we said your cerebellum controls your balance, coordination, and the postural muscles of your back. It's also responsible for sending nerve impulses, to get into that frontal, lobe of your brain, which then sends impulses to the lower brainstem and regulates that upper brainstem. Now, the cerebellum is the most oxygen-dependent organ in your body. That's why during our initial evaluation, we check your oxygen saturation levels as well as your tissue perfusion levels. What this tells us is how much oxygenated blood is making it to your extremities and to your brain. Now, most patients I have seen with their oxygen and tissue levels are low in fibromyalgia patients, and your cerebellum is not getting the fuel that it needs. This is why your oxygen levels would be low. And why are these oxygen level lows? Well, your body's ability to absorb oxygen over time, diminishes because of toxins, and this is caused something by, oxidative phosphorylation. All right. Now, how do we correct this problem? We use oxygen therapy in our office. Oxygen is fuel for your brain and nervous system. Your brain and nervous system need two things to survive: fuel and activation. Fuel comes from the oxygen and glucose. So by using oxygen, we can help you heal faster. Glucose, of course, comes from the food that you eat. Now, by doing exercise with oxygen, this can actually increase the firing of your brain and help many chronic health conditions. Now, what other brain-based therapies? Oh wait, there are many other brain-based therapies that we can use in your office to help create your kind of fix your nervous system, your cerebellum. We may use vibration therapy on one side of your cerebellum. We may use something called an upper body ergometer, which is kind of like an exercise bike for your arms. And we have you do this while you're on the oxygen. What this does is increases the firing of the posterior muscle groups of your neck and your arms, which stimulates a tract called the cuneus cerebellar tract, which stimulates the cerebellum, which kind of increases the activation of your brain, creating these new neural pathways. We may use olfactory stimulation or smell therapy on one side through one nostril. We also may do something, we do unilateral adjustments on one side of your body, either manually or with an instrument to help stimulate your nervous system. We may adjust your extremities, which inhibit brain impulses in different parts of your body, or have pinched nerves and restrict your movement. Now, there are many other brain-based therapies that we use in our office to help treat your condition. And we base our treatments on a complete evaluation and tailor our treatments to the needs of each individual patient. Now, we don't treat the diagnosis or condition, we treat the individual patient. As you have heard on this video, there could be many different causes of your fibromyalgia. As you have heard on this video, there can be many different causes to your fibromyalgia. Only by checking and addressing all of them can you truly get better. Now, I hope you enjoyed this presentation. If you would like to set up a complimentary consultation and screening to see if you are a candidate for our fibromyalgia treatment program, please call our office, 508-620-1585, or you can visit metrowestspineclinic.com. Thanks for watching.